with Jeet
on Radio 44.
Well, in today's Morning Mojo, on the Morning Mantra, we talked about how health is wealth. And there are certain people on this planet who are gifted with everything you need to ensure your health is absolutely perfect. Today, in the studio, we do have a visionary, Dr. Aalap Shah, all the way from India. Now, this guy is a phenomenon. He's the founder and director of Mission Health in India. He's revolutionized the world of physiotherapy and rehabilitation with his expertise and dedication. He's got a team of over 400 specialized physiotherapists. He successfully treated over 110,000 patients. All right. And right now, Dr. Aalap Shah is in the studio with us. We're going to be talking about a lot of things that you have been worried about. And, well, all the answers are right here. So keep it right here in Radio 44. Right now, back into the music. Well, a very, very good morning to you right here. Radio 44, your music, your life. And like I said, we do have Dr. Aalap Shah, visionary, a man who has helped a lot of people ensure that their lifestyles will be different. And of course, they will be healthy. I keep saying this. Health is one of the most important things. And Dr. Aalap Shah is the man behind a lot of people smiling after their lives have been transformed by you. Welcome to the show, sir. How are you?
I'm fine.
Yes, it's great to have you over here. Of course, the whole of Nairobi is talking about you right now. The whole of Kenya right now is talking about you. So let's start off with this. Of course, you are the founder and the director of one of the best hospitals out there, rehab centers, Mission Health. Can you tell us a little more about Mission Health, please?
First of all, I'd like to wish good morning and Jambo to every listeners. Mission Health is world's finest and India's first ever chain of physio, fitness and rehab facility. In fact, in 2005-6 year, me and my wife, Dr. Disha, when we were doing our masters, we were keen to bring the concept which were few of the finest concept in the world and not available in Ahmedabad or India. Or there were so many concepts which were in our books but not implemented in real life. So we decided to launch this multi-super speciality physiotherapy and rehab center, which had multiple divisions like orthopedic, neurology, pediatric, geriatrics, cardiac, pulmonary, women's health, sports sciences, vascular. It was one of its kind of planning, thought process, blueprint. And then we launched just with the team of 3 physios in 2007. Today, by the grace of God, trust, love and support from our patrons, 17 years of our work, we are a team of 400 physios.
Excellent. So what was the inspiration? You said that you found that there was a void, there was a gap, but personally, what was your inspiration to start this journey?
I believe in 2 things. There are 2 most important points in life. One is when you are born and second is when you know why you are born.
Right.
Physiotherapy and rehabilitation is such a subject. At the end of the day, when we treat 1,000 patients and coming from 300 cities and bring abilities to different patients, smile. Imagine 40-year paralyzed patient starts walking again. Imagine 3-year kid who was not able to walk starts walking again. Imagine 60-year auntie who was advised knee surgery is walking without knee surgery. So when you meet patient or relatives, brings big smile and ability, and every day we feel complete satisfaction.
Excellent. All right. Now, here's the thing. So how many branches do you have and what sets you apart from other organizations?
So whatever best possible, we have traveled to more than 13 countries. We have kept studying. In fact, I completed my PhD in spine just 2 years back.
Okay.
So whatever best possible concept and technology available in the world, today if something is launched in 2024 January, it is with us. So that's we do. We have 8 branches in Ahmedabad located across 250,000 square feet so far.
Okay.
And we are also coming up before the end of this year, 9th branch in Ahmedabad and 10th branch in Surat city of Gujarat, India.
Excellent.
So in total we will be having more than 3 lakh square feet area of spread.
Excellent. Now, of course, you came here before, but this time you had a couple of successful talks. We usually hear of, such conversations happening in one city, but you actually went to 3 cities, Nairobi, Eldoret, Kisumu, 19th, 20th and 22nd, 21st, right? Back to back. How is your experience in Kenya so far?
Kenya is outstanding. If I tell weather-wise, Nairobi is cold, Eldoret is cold, and Kisumu is warm.
Yes.
But if I say people-wise, I have experienced highest level of love, warmth, hospitality, and sense of community. This is just amazing. I felt like I am in my hometown.
Ah, beautiful, beautiful. And of course, if you feel at home, then you'd be happy. How many people have you, come across and met during these talks so far?
These 3 days, we have met almost 1200 plus people, including all these 3 cities.
Right.
And many more to meet in these 2 days before I head to Masai Mara.
Oh, I'm sure even if you go to Masai Mara, people will be over there looking for you, right? Nevertheless, keep it right here at Radio 44. Of course, if you have any queries, you can get in touch with us. Right now, we are taking a small break. We will be back and we will be talking about your spine with Dr. Aalap Shah. Keep it right here on Radio 44. I think from childhood, most of us have always seen the advertisements of Move. We're always worried about our kamar. We hear our mama, mummy, our mama, our masi, everyone talking about kamar pain, the back issues. And after a certain age, we all have back issues as well. I'm one of them as well. But I understand you have a PhD when it comes to, the knowledge of the spine and healthcare of it.
Yeah.
So Dr. Aalap Shah, let's go straight into the spine right now. What are the common issues of the spine that you see frequently at Mission Health?
Postural neck pain, postural back pain, spine alignment issues, overuse injuries. If I give proper names, slip disc, sciatica, neck pain radiating to arm, canal diameter narrowing called as lumbar canal stenosis, spondylolisthesis where one vertebra is moving forward in comparison to another, alignment issues, kyphosis, scoliosis, and sometimes because of osteoporosis, bone vertebral body collapses called as osteoporosis and bone fracture.
Oh dear. Okay.
But I would like to tell very important thing. If there are 4 important reasons for spine issues, namely age, accident, medical condition, and lifestyle posture. Out of all 3, the top cause and top reason is lifestyle posture, more than age, medical, or accident.
Agreed. I think especially in this day and age with technology, all of us are bent over a lot more looking into screens and phones. So that makes sense. Now, you did mention slip disc, sciatica. So what is, the main difference between these two? And we've heard of slip disc quite a bit over here. Can it be reversed? So if you could answer these questions.
So Jeet, human spine has got 33 vertebrae, cervical, dorsal, lumbar, and sacrococcygeal. Each vertebral body which is hard has got intervertebral disc in between, which is soft. There is gel in the center surrounded by the outer covering. The structure and function of the disc is not only providing mobility but lot of cushioning.
Okay.
Now what happens purely due to wrong posture like prolonged sitting, weightlifting, wrong techniques, the outer layer of the disc gets affected and central gel bulges out. Now if that gel is bulging on the ligament, it gives you back pain. The minute it is pressing on the nerve which is traveling from buttocks to leg, the longest nerve of human body called as sciatic nerve, when disc bulge results into pressing the nerve, we get symptoms of sciatica like pain, heaviness, tingling, numbness in the legs or inability to walk more than few minutes. So slip disc is a cause and sciatica is a outcome.
The outcome.
And now 95 to 98% of slip disc patients can be treated even without medicine, injection and surgery. There is a fantastic technology called as slip disc reversal program. With the help of software, computer guided technology, we can reverse the disc bulge to some extent, reducing the pressure on the nerve and preventing neurological symptoms and complications.
Right now what you've just said is just absolutely new to me. So this is possible without any surgery, anything.
Absolutely. More than 60,000 spine patients are treated at Mission Health Ahmedabad so well. And out of that, at least 300-400 patients from Nairobi city have been prevented from spine surgeries, and they can vouch for it.
And this procedure, is it a long, does it take long?
It takes at least 20 sessions.
20 sessions.
Yeah.
Okay.
It takes time, but very safe, right?
Right,
You're not putting knife on your spine.
Yeah,
You know the weight of spinal cord, Jeet?
No.
Just 35 gram.
What?
If brain is 1200 to 1400 grams, spinal cord is just 35 gram. Such a sensitive neurological structure protected by our spine. So we need to deal these issues with
Very
so much
carefully.
sensitivity.
So with 20 sessions, sorry, I'm sort of expanding on this because this is unheard of, 20 sessions over a period of how long?
20 days and 20 sessions.
That's it.
Daily one session. Yeah, you are done.
So within 3 weeks,
You are good to go.
that is phenomenal. Could you give any? You did mention that the number one cause is posture, lifestyle. So could you give any tips, on how we can actually keep our back healthy?
So there are predisposing factor and there are precipitating factor. Two most common reasons if we work on, we can prevent back pain and neck pain. Number one is ideal sitting and number two is ideal lifting and handling of things the way. First of all, the golden tip that I would like to give every listener, change your posture every 30 minutes. If you are sitting, assume standing or walking for 20 seconds. If you are standing, assume sitting, but you need to keep your posture, changing your posture every 30 minutes. And the surface on which you sit should be firm. If surface is very soft,
Yeah.
like Dunlop, if you sit and surface collapses, it is not an ideal surface.
Right.
In the same way, you have to maintain 90, 90, 90. That is, hip and knee should be at the 90 angle, spine should be straight, foot should be supported on the ground. Another important thing is lifting technique. When you lift an object, be mindful, be close to the object, prepare yourself and lift with hip, knee, foot and lumbar combination, not just bending from the lumbar spine.
Right.
And keep doing lumbar exercises regularly.
Perfect. Okay, we will be back right after this. Got to say that you've blown my mind with what you've just said. Studio. I do have Dr. Aalap Shah. Now, here's the thing. I think anyone who's been listening to me on Radio 44 constantly laugh and hear one thing from me, and that is, oh yeah, if you think I look young, take a look at my knees or the sounds that come out of my knee. Okay, this is a common thing, it's a joke that we all say. Yeah, you know your age when you're standing up and you hear those in your knees. So let's talk about knees and knee pain. What are the reasons for knee pain?
You talked very nice statement, Ji.
Huh.
You are as young as your knees.
Yes, very true.
So there are mysteries around knee pain and there are more than 13 reasons of knee pain.
Okay.
Simple, being overweight, overload on the knees, to muscle imbalance, to alignment issues, to degeneration, that is osteoarthritis of different part of the knee joint, or ligament injury, or meniscus injury, or uric acid issues, gout, or autoimmune conditions. So out of these reasons, we need to peculiarly find out on the basis of history and examination what exactly is cause of your knee pain. Then we can treat the condition very, very well.
Yeah, now speaking about treatment, majority of the people only have one solution, knee replacement. So the question is, can you get away with it? Can you treat knee pain without surgery?
Every knee pain is not degeneration, every knee pain is not Gassaro, and every knee pain doesn't require surgery. So out of the classification that we make, we have to identify there is a below 40 classification, above 40 classification. In fact, in my talk on 19th July, I show the video of one of my patient, Mrs. Hemba Jhala from India, 104-year female,
Okay.
with natural eyes and natural knees.
Okay.
She started getting teeth again and climbs 3 floors up and down.
Phenomenal.
So we have to focus on working on knee preservation program, how in the best possible way we can rehab. If we can rehab then and repair with conservative method, then why to replace?
Excellent. Yes.
Nature is nature.
Yeah, this is phenomenal, because usually what we hear from doctors is the usual, let's replace it, because it's an expensive affair, and that's what we all feel. These are the things we think about. Now, here's another thing. As much as you are an expert when it comes to treating knee pain, you're also an expert at advising on how to prevent knee pain. So for people to actually avoid any knee knee injuries, etc. What are the best ways? What are the tips you can give for that?
First of all, control the weight. Every 4-pound loss will reduce 40-pound load on the knee during certain activities.
Okay.
Second is keep knee muscles stronger.
Right.
With age also we lose muscle mass, and after injury also, if we do not rehabilitate proper, that particular part is always weaker. So we need to do proper muscle strength, endurance control technique. We also must have good proprioceptive control over our knee. That means good reflexes and reaction timing. So in all the challenging situation, we can prevent the knee injury from happening. And we must always do mindful movements.
Right.
Neither overdo nor uncontrolled movement. For example, we are looking somewhere and we are doing something. Somebody is descending stairs, looking at the mobile, and suddenly he falls and gets the injury. So be mindful of everything that we are participating. In terms of even participating physical activity, we must be aware about our own capacity and be built up gradually.
Excellent. We will be back right after this. It is a sunny day, and we do have Dr. Aalap Shah right here in the studio with us, of course, founder and director of Mission Health in India. Now, let's talk about this. We're still on the whole topic of the spine, the knee. How does foot alignment affect knee pain?
Very interesting question. 30-year young, thin female suffering from knee pain without any history of injury. 6 months she is meeting different consultants, getting different X-ray, MRIs, and not able to get any conclusion. No diagnosis. She enters our Mission Health Knee Clinic. We look at her feet, and immediately we realize the reason for her knee pain is right there in her feet. So hip, knee, and foot work in close coordination with each other. Foot is the foundation of human body and first contact point between body and ground. So we have our arches on the feet. If we lose that, it directly affects patellofemoral joint of knee.
That's a flat foot.
Yeah.
And you see a lot of those?
Absolutely, Jeet. The number of flat feet are increasing like anything.
Here's a funny thing. I'm going to say this. I also have mine. I've never seen an arch in my feet ever.
No, but we must have our arches. It has its own role and function. Otherwise, it impacts our foot, knee, hip. And what happens today? Flat foot are increasing. The reason is overweight, weak muscles, injury. But the most important reason is nature versus civilization. Okay. Previously, we used to walk on, move on soft surface.
Right.
Grass, sand. So surfaces used to adjust us. Today we walk on hard surface. So we have to adjust to the surface, and arches of the feet are getting collapsed like never before.
So it's a form of basically we are evolving, but it's not evolving in a great way, is it?
We are evolving in a negative way. In terms of fit. We did one fantastic event called as Indian Foot Festival.
Okay.
In 2020.
Lovely.
And that got India Book of Records award, where 600 flat feet patients from all parts of the world participated in this one-day event.
Okay, this is super interesting. We'll be back right after this. Still got Dr. Aalap Shah in the studio with us. Now, Dr. Aalap, I have to talk about this. I think this is one very important thing. We've seen people, especially after a certain age, there are certain people, and even youngsters that we've heard of, that we know personally, who have a problem when it comes to urine. So, there is this lack of control. Some of us, we can hold, as we say. We can hold perfectly. We're okay. We can hold on for hours. There are other people who just have no control whatsoever. And, it puts them in a very difficult situation where if they don't have access to a bathroom, it becomes a huge factor. So, of course, it also helps, it affects your mental health. It affects your confidence in going out, all these things. So, what exactly is the cause of this? What is it?
So, urination process is basically well-controlled process. Brain finds desirable situation, then only we perform this. But when brain is completely in control, but the muscles, we have got pelvic floor. This is the group of muscles, ligament and connective tissue running from front to back between the thigh. They have the function to support three most important organs: bladder, uterus, and rectum, and they control the continence. Now when these muscles go weak, we tend to lose the control. For example, somebody is coughing, sneezing, laughing,
Right.
and then intra-abdominal pressure rises, which results to intra-pelvic pressure rising. Pelvic muscles are not able to hold, and leakage happens. Imagine you are sitting in important meeting,
Yes.
or on the stage, or laughing out loud with a friend, and suddenly your body starts betraying you.
Yeah.
So
yeah.
this subjects needs highest attention. And simple solution is start doing pelvic floor exercise from early days of life. As a lady is planning pregnancy, during pregnancy, after delivery, during menopause, if hysterectomy is to be done, diabetic, and this is important for male also.
Yes,
The
yes.
data is 50 to 70% female, but 30% male.
Male as well.
So it is important for both the population.
So it's not the end of the world. It can be done. It can be treated.
Fantastic. And there is one is pelvic floor exercise.
Yes.
It is formally known in Indian yoga as Mulbandha.
Okay.
Or in current science, it is the term used as Kegel's exercise.
Kegel, yes.
But we do use this advanced technology where we give 12,000 contraction in one session, and within 6 sessions, the urine leakage is solved.
Did you say 12,000
Contractions in one session.
in one single session?
And such 6 sessions, non-invasive, you have to just sit on the chair and the contraction comes, and you are wearing clothes, fully clothed, reading book, and you are done.
You know, when you said advanced technology, I didn't expect it to be advanced in every angle whatsoever. That's well done. All right, we're taking a very short break, and we'll be back to talk more about Mission Health. Keep it right here on Radio 44. Beautiful track right there, and of course we're having a beautiful day right here at Radio 44 with Dr. Aalap Shah. Now, of course, like he said, Mission Health is known for, having the world's most advanced neuro rehab facility. So what kind of, neuro conditions do you treat the most?
Traumatic brain injury, brain hemorrhage, brain stroke, spinal cord injuries, cerebellar ataxia, Parkinson, Guillain-Barré syndrome, neuropathies, and many more.
Many more. Okay, and one of the most important things, one of the scariest things that we've seen is people who have brain strokes. When they have a stroke and then their brain, just doesn't function the way it's supposed to. So how do you achieve faster recovery, using neurorobotics, which you guys are experts in?
So we use this concept of early mobility and verticalization with physiological movements. When I say this, the science is very clear. When the person is paralyzed, either the way is to wait for 12 months, 2 years, depending upon his brain damage, versus even with zero power, in our robotic setup, our robots and physios simultaneously make patient move. Imagine you don't have any power in the legs and we make you walk, and in a physiological pattern. So that walking pattern is continuously registered by the brain. And with the principle of neuroplasticity, brain starts relearning.
Yes.
And the results are just fantastic. If somebody says this guy is going to take 12 months to recover, at Mission Health Ahmedabad we try, he recovers in 3 months.
Excellent. That's phenomenal. Now, for sure, I'm sold. You and I, we've been having conversations on me coming over to your place, right?
You're coming to Ahmedabad, yeah.
Yes, definitely. Now, I'm sure there are a lot of people out there who feel the same. Now, let's talk about that. So there is the concept of rehab tourism, okay? How does it work? What are the benefits?
So we have complete facility. We have in-house inpatient department called as rehab suites, where facility starts from patient's paper for visa. When patient arrives at Ahmedabad airport, our team picks them up.
Excellent.
They are brought to our accommodation facility with in-house kitchen and everything.
Okay.
Their consultation is done. Proper treatment plan is made. If any reports to be done, they are managed immediately. Once the rehab plan is done, depending upon their problem, orthopedic or neurology, whether 2 hours or 6 hours rehab is done every day. Once entire treatment program, we also keep updating. If some elder population has come, their children about the progress every week. And once the program is over, with complete guideline, videos, discharge summary, our team safely drop them back to airport.
And what about accommodation?
We have in-house fantastic accommodation facility, Jeet. You feel you are in one of the very good wellness facility and at a very, very comfortable, affordable rates.
Excellent. Now, you and I had a conversation, and I think that we need to discuss a little. Just every time I've gone to India for any treatment, family treatment, whatever, the thing that we see is there's a local rate and there's a non-resident rate. Is that the same with your case?
We are very clear, very transparent. Whether you are coming from Africa or US or Jamnagar or Ahmedabad or any part of the world, our rate list is absolutely clear. If you are charged 100 rupees, your friend from US will also be charged 100. But yes, if you are taking something different level of technology for robotics and the charge is 200, but then the 200 is same for us. And we don't do this asymmetry because at the end of the day, our work is so much reference based and we want to be, whether you are coming from whichever part doesn't matter to us. It is absolutely transparent and fair. You are coming to us with immense trust from different part of the world. So we will be, only thing is what kind of treatment you are receiving will be different.
Dr. Aalap Shah, thank you so much. It's been an absolute pleasure, and I think there's so many things that I never knew was happening in the medical field and, you know, with physiotherapy, and you have enlightened me and enlightened thousands of people, you know, upon your visit over here, and of course, you being right here at Radio 44. Thank you so much for your time. Continue doing the great work that you and your phenomenal team are doing. It's people like you who actually give everyone hope, because we feel like life has ended. But when you do what you do, people realize that there's so much more to life.
I agree with you. Our motto is also movement is life. Asante sana.
Thank you so much and have a beautiful, beautiful time in Kenya.
Thank you. Thank you once again.
The hits you love.
Feel good vibes and great music. This is Radio 44. Your music, your life.